Mclelland. So we'll be answering some questions for you today that you've sent in throughout the week. Very excited. Just waiting on Dr. Mclelland to hop on this call. Having coffee. Went running this morning. Helps me a lot. What's funny is I'm not a runner, but I think a lot of people who are not runners are running. If there's nothing else to do. Good morning.
Good morning. How are you?
I'm
You
doing
say
good.
you said you went out for a run this morning?
Yes, the past couple mornings, well, past two at least. I feel like the more I struggle, the more I need to just get out and exercise outside in the morning before everybody's up. That helps.
Amen. Well, it was cool this morning and it's going to get quite warm.
Yes,
Uh,
I know. I'm not one to run in the heat. I see people running like 97 degrees in the summer, and I'm like, how? How are you not dying right now?
Not
So no,
me. Not
I'm an
me.
early morning or not at all kind of thing. But
Well, it's another beautiful day and I hope everybody gets outside even if it's for 20 minutes. And most
yeah,
of us have enough time to make it 30.
I know. But it's true. It's like, but where to go? You know, that's kind of one of the things. We
I
luckily
know.
we have at least a little backyard, and we've like made the most. We have a little blow up pool right now and everything. So
Hey,
chalk and
blow
bubbles
up
and
pools are for more than just little kids.
oh, I
Um,
sat in it yesterday for sure.
well, I don't blame you. We've gotten a lot of great questions today.
Mm-hmm.
Um, and what I wanted to do first was go over a little bit of an update about the coronavirus because what we discuss seems to change on a weekly basis since we don't
Yep.
know as much about this disease as we wish. Um, I think right now, my biggest encouragement to those listening is please, please continue to social distance. It really actually does work. Washing hands does work. Um, you'll see more and more people wearing masks. The best benefit for masks is really avoiding touching your face. It
Hmm.
does reduce the spread of respiratory droplets if somebody sneezes or coughs right in front of you, but it doesn't eliminate it. And the other thing it does is it reminds people when they see you wearing a mask, it really reminds them to social distance. What happens and what has happened in other places is people get sick of the social distancing because we do. And then people
Because it's
start
challenging.
because it's hard. And then
Yeah,
people start getting together again. And then we see a pickup in infections. Um,
absolutely.
right now, the projection for the quote surge around here is the end of
And by here we
April.
mean Chattanooga, right? Chattanooga,
Chattanooga,
Tennessee.
yes, Chattanooga. The expected surge is the end of April, and surge is different from peak. Surge is a rapid increase in infection rate.
Mm-hmm.
Um, and so I would just encourage people, and I think one of the biggest challenges is get outside, but where to go? But you know what? We're resilient people. We can figure it out.
Yes.
Um,
And I have to say, when I went to the grocery store this past week, that was kind of like the start of, for me, like this emotional change about the coronavirus this past weekend. But I went to the grocery store Friday, and it definitely felt different than it has yet. And I think it's good because people are taking it more seriously. I say at least half the people were wearing masks.
yeah.
But it's interesting how when the only time you get out is to an environment that is like that, it feels, I mean, that's exactly what we need to be doing. And emotionally, it feels kind of crazy, you know? Um,
Well, it is
so,
crazy.
yeah.
It is crazy. Um, some of the scientific information, there's still no evidence that the coronavirus is passed through breast milk. Still thought through respiratory droplets. So if mom passes to baby, it's not through breast milk, but because a baby is within 6 feet. It is recommended if breastfeeding is chosen during the time mom has coronavirus, than to wear a mask. There's still, the risks during pregnancy are still unclear. Pregnant women still do not seem to be at highest risk for getting really sick, but we know that they are at risk for other viral infections like the flu. They are higher risk. There is still limited evidence of vertical transmission. Vertical transmission means if mom gets sick, they can make their baby sick. There are a couple reports out of China suggesting that it may be, but still considered very rare.
Once
Children
again, you're
do,
talking about pregnant women, right?
pregnant
So,
women, yes, yeah.
yeah,
So a baby getting sick while mom is
in
pregnant.
utero. Okay.
Correct. Children do get sick, and this is one of the issues that I see the most with social distancing, is not social distancing our children.
Yeah.
And that's really so important. It's unclear risks of preterm babies, but they're a vulnerable population. Newborns don't seem to get a ton sicker, but they're still hospitalized. And
Yeah.
that's the big thing, is you don't want a newborn in the hospital. I mean,
No. And I have to say, I think that for me, when we first started hearing about coronavirus, a long time ago, but like when this all started, it was kind of said that basically younger people and kids were almost, not affected. And I think what I'm certainly seeing and realizing based on stats of positive tests across the U.S., for example, is that that's definitely not true.
Usually their cases are more mild, but what seems to be the biggest issue is they're the ones that pass it to the adults.
Yeah.
So they're the ones who get the adults sick. And
But there also have been quite a few kids hospitalized because of
oh
this.
yes,
And
yes,
I know in Chattanooga we
definitely,
had
yeah.
a child pass away last week. And to be fair, there were other medical complications, but part of it was COVID as well. So like this is not something that doesn't affect children.
Yeah,
Um,
I think the emphasis on what you just said was that in children, where kids have gotten really sick are ones who have other health issues,
Medical. Yeah.
like severe health issues, not
Yeah.
minor, but pretty severe. Um, and so the kids that need to be quarantined are the ones that have fairly significant lung disease, heart disease. Um, those are the ones that especially need to be quarantined. Um, that's kind of an up to date on that. One encouragement that I want to give is how amazing the healthcare providers are
Mm.
working together. I have seen people working together that I didn't always think would. Um, and it is amazing, despite everybody's own personal fears and concerns. Everybody is jumping in, and people are saying all over the place, I'm made for this. And one of the best encouragements that I can give is, even though there is a limit on visitors on labor and delivery, the nurses are still doing an amazing job.
Mm.
We are still maintaining standard of care, still helping people. We have excellent protocols in place to protect women. So I can promise you the healthcare providers that I see are doing their part. And that's another plea for you guys to do your part with social distancing. But if you know a healthcare provider, last week, Erlanger softened its rules about bringing food, that you can actually bring food or you can order out food. You just can't have the delivery person come into the hospital. And
Mm-hmm.
on Friday, somebody delivered enough pizzas to feed all the staff at downtown Erlanger for lunch.
Aw.
I was like, oh, I love
I
it.
know.
I love it. I love it.
No. All this stuff's going to
Um,
get me emotional. Like, yes.
I know. I know. So let's get on to some questions.
Good.
Um, Do you have any resources on bladder neck insufficiency? I'm 10 months post baby, still leaking with daily activity. I've been to pelvic floor physical therapy. Incontinence got worse after I stopped breastfeeding. Both my OB and PT say I don't have prolapse and I have to keep waiting and hopefully it'll get better. I had an appointment with the UroGyn but was canceled due to COVID.
Mm-hmm.
Great question. At this point, it's been recommended to limit unnecessary, I wouldn't say unnecessary, but non-emergent appointments.
Mm-hmm.
And there are no hospitals in the area that are doing elective surgeries, and incontinence surgeries would be considered elective. I have no idea, nobody has any idea of when that will be lifted. It'll
Mm-hmm.
probably be lifted after the expected surge, but if people do not social distance and there's another surge, then that's probably going to continue. So, first of all, I would encourage you to call the urogynecologist and see when you can get back in. But there's a couple comments. There are a number of reasons women can continue to leak after having a baby, not always related to prolapse, but it is typically related to the weakness in the support tissue under the urethra and the bladder neck. If it's going to spontaneously improve, usually within the first 6 weeks to 6 months. If
Yeah.
somebody's still having leaking after 6 weeks, that's when I refer to physical therapy. Um, some women can benefit from pessaries, which is like a rubber donut or ring that can help hold your bladder in place. Um, but that does require a visit.
Mm-hmm.
Um, some women can use tampons to help. It doesn't work the same as pessaries, but it's for some women that actually helps. Um, Lifestyle changes such as weight loss, avoiding caffeine, avoiding constipation, avoiding activities that increase leaking. Obviously, taking this with a grain of salt right now, um, the idea that surgery is being limited as well. I encourage people to do the lifestyle stuff right now more than ever because of the limitation. Um,
Yes.
and most women, if they have leaking, then in this situation, usually surgery is going to be the answer. But of course, that has to be evaluated. Um, this young woman requested some websites. Some websites that I refer to would be WebMD, Mayo Clinic, urologyhealth.org. So those are a couple websites. But bottom line, this young lady needs to be evaluated and then discussion of surgery.
Yeah. Can I add that, like you were saying, so first of all, and this is us not assessing you in any way, shape, or form, but bladder neck insufficiency, I wouldn't naturally, based on what I'm reading with the question in her history, I wouldn't assume that she has bladder neck insufficiency necessarily.
Oh,
Would
good.
you?
Yeah. No, I wouldn't. And that, thank you for clarifying, because really, um, the really you need to have an exam.
Yeah.
And
So I don't know if someone like diagnosed you, like patient, or if this is just something you're wondering because you feel like traditional methods have been unsuccessful at this point. But I can say that I don't typically think if someone's not leaking, but then they're leaking after they weren't leaking before they had a baby, they had their baby, and now they only leak when they exercise. I would not think bladder neck insufficiency. That would not
you
be
are, yeah.
that would not be one of the things that I'd be like, hmm. So one, I would kind of dive into what have you been doing in pelvic floor therapy? What has your physical therapist been doing? Has she been assessing your pelvic floor? Has she been using some of the tools like biofeedback? Just because I know a lot of therapists nowadays who treat pelvic floor and incontinence don't necessarily do any of those things, depending on who you're seeing. They may not. So I think I would ask some follow up questions about that. Also, I would just want to make sure that I think seeing a urologist is a great idea, right? Having that conversation, like Dr. Mclelland said, staying away from some bladder
Well,
irritants.
I'm going to interrupt you for just a second. So
Okay.
urogynecologist and some obstetrician gynecologist, or a lot of obstetrician gynecologists as well. But bottom line, it does need to be evaluated. And
Yes.
I didn't completely address the terminology bladder neck insufficiency, because that really is an exam, and sometimes urodynamics, which is a specialized study. Um, so so that's why I didn't completely address the terminology used. Um, but maybe that's more from what somebody read.
Yeah, I know a lot of people, if they're unsuccessful, they're like, well, maybe I have this,
Okay.
right?
Yeah.
And that's just where my mind went with the question. And so my thought is, I wouldn't assume you have that yet. There's a lot of other tests and follow up that can be done
Correct.
to help give you direction. In the meantime, see if staying away from bladder irritants helps. So coffee, alcohol, but also it is very normal to
Sodas.
sodas. I know all the good
Yeah.
drinks basically, but make sure you drink plenty of water. But someone who just leaks with exercise, that is a normal progression at least, right? Like we want to make sure that like, so for instance, it's not uncommon for people to be like, I'm not leaking now when I walk, but I am leaking when I jump. Like that's a very normal progression
Right.
to improvement still. So I wouldn't give up hope yet, but during this time, I would say keep doing your exercises, stay away from some irritants, and then get an appointment once things lighten and you're able to. Um, so
You know, it's interesting. A comment that just popped up said so many women have never heard of doing Kegel exercises. And I'm really glad that somebody put that on there. The challenge with Kegel exercises, it's exercises for your pelvic floor. But I have found a lot of women, especially at their 6 week visit, can't engage them correctly. So I'm always
mm-hmm.
a little bit careful about just saying, oh, go do Kegel exercises, because so many women don't do them correctly because of the weakness.
Yeah.
So that, in my mind, discussing Kegel exercises is more about um, an office visit and an exam.
Yeah. And you're 100% right. I think that in this moment where a lot of people don't have that option, depending on where you are and what's going on, right? Um, I know that through telehealth or through like the program where we talk things through, we get in depth about like, even if you're literally trying to do a Kegel looking with a mirror or what are some imagery things, like we kind of go in detail of what does a proper Kegel look and feel like? What does properly relaxing your pelvic floor look and feel like? So there are ways that pelvic floor PTs can help guide you in that during a season where you can't go in for a visit. And if you're interested in that, of course, you can private message me and I can help set you up with that. Um, but yeah, because it's kind of like we're in this weird season of we have to
It is
try
a
to do the
weird,
best we can, you know?
it is, and I think because when I'm like, okay, I need to see you, well, I can't. So how can we get around it, or how can we help you get through this time?
Yes,
Um,
yes.
then do belly bands work? I'm going to answer that, but I'm going to also want your opinion.
Okay.
Um, my personal opinion in general is I don't recommend them unless somebody cannot get out of bed after having a C-section, and typically while they're in the hospital. And the reason why I don't recommend it is because it is supporting your abs and it is keeping your abs from learning how to engage. So as a transition for a short period of time, I think it's reasonable. But in most instances, it just delays the timing on when you're going to start getting your core to start working again. What do you think?
So I think this is a really interesting question and one that my opinion has changed through the years. But I think in general, most people don't need them, like you said.
Mm-hmm.
I think that they're usually unnecessary. And um, I think that the one exception to the rule is if someone has very significant diastasis. I'm talking like 4 finger widths at least. Um, and maybe they had significant diastasis in previous pregnancies, and so they know that they're coming into this. Like I'll use myself as an example. I had 6 finger widths after Mira, and so with my third, I chose to go ahead and use a belly band of sorts. Now there are really bad ones out there, and I think there are some good ones. The one that I used is a brand called FitSplint, and I like that one. It comes from the back and wraps around both sides. So, because you think about the muscles we're trying to help. So the purpose of the belly band for me was not to like get a smaller stomach or help my abs activate. Of course not. For me, it really was about, I had so much separation and weakness in the front through the fascia that I thought the band coming from the back and wrapping around kind of helped approximate that a little bit. And kind of the way I viewed it was it gave, in those first couple early weeks, it gave my muscles and fascia the chance to recover a little bit more in a connection, because it took some of the tension off. Because here I had extra weight on my belly and the muscles were all weak. So everything's pulling down and out. So this kind of allowed that to come back together to allow it the possibility of connecting a little bit better. That being said, you don't want anything super rigid. So some of the ones I've seen are almost like a corset material. I like that the one that I used has like flexibility to it. And then also you have to be very careful about over cinching if you have pelvic floor weakness or prolapse, because you don't want to cinch the middle of the waist and have all the pressure pushed down. So I think that I really only recommend them for people with significant diastasis, and it's meant to be a transition thing. So you don't want to rely on it. I know I weaned myself off in the first 4 weeks was kind of the goal. I did feel like it really helped my fascia and my diastasis heal. But once again, I was also doing my corrective exercises. I also was working on my posture. And as I weaned myself off, I also had a C-section. So there's that as well. But as I weaned myself off, I then like at 4 weeks only used it with exercise. And then I only used it, so I like kept bumping back. But it doesn't help your muscles activate, right? It can work
Well,
against you in that way.
the other thing I do want to remind you of is you were extremely careful when you put it on. And
Yes.
I remember seeing you and we were adjusting it. And I remember going, wow, I'm glad she has the patience to adjust it. Because
So,
so there's so many variables that I think that, yeah, if you use it right, you're patient with adjusting it, you wean off of it. I think that's great. I just think it's really challenging unless you really, have a lot of background.
yeah, it's ideal
And
to have someone guide you through it if you are
yes,
even needing it. So my
right.
stance is belly bands no, unless you have previous significant diastasis or you have like a PT or doctor helping you figure it out.
Yeah.
Um,
Yeah, but
does that sound good?
I think that sounds great. I think that sounds great. I just remember watching you put it back on and me going, "Whoa, you are patient."
Well, and one of the things I liked about the one I had too is it has like a silicone on it. So I put
Yeah.
it directly on my skin. So as I put it on, it wouldn't slide very much once you put it on, compared
That was a
to,
good point. That was a good point because a lot of people will wear it over things and it just slides all over.
yeah, it's not
So,
any good. So, and things can be too rigid and too hard. Any material that doesn't move, I would not recommend personally when it comes to belly binding at all.
yeah, so those old-fashioned corsets with bones,
Oh my
stay
gosh.
away from them.
Well, I mean, even I know the first band I had after C-section just to wear for a little bit, I didn't like it, wasn't comfortable, and it was basically just like a brace, and it
Yeah.
was fairly rigid. So I only like belly bands that have flexibility to the material as well.
Oh, yeah.
So,
So the next question is, I have no access to, or given there's no access to massage therapists or chiropractors right now, are there any recommended stretches or practices a partner can help with to relieve some of the discomfort after birth? For me, I can tell that my right side isn't in great condition, all the way from my neck down to my hip that I can feel is out of line and causing pain down to my knee. Um, I think there's a bunch of things you can do. First of all, I would encourage you to find the areas of greatest discomfort. Oftentimes you'll have little areas of tense muscles called trigger points, and your partner can definitely massage those areas out. You can put heat on it. You can also Google what
Get
muscles they are.
You can get a tennis ball and work that
Tennis ball,
spot
yeah.
out as well if you don't have a partner to
Um,
help you yeah.
and there's a bunch of like different areas you can get the foam roller, tennis ball. Those are all great ideas. You can put heat on it. You can look at those muscles up online, figure out which muscles they are, and then find stretches. I've found that the biggest trigger for this is poor body mechanics.
Mm.
We swoop down, pick up our baby, we plop that baby on the same hip. And so, what I would do is I would assess how you're nursing. Um, if you're nursing and you're hunched over like this, your neck will definitely hurt. So finding a better, more comfortable spot. Um, See how you are leaning over to pick things up. Which side are you carrying the baby? How heavy is your diaper bag? How are you carrying your diaper bag? Um,
So you bring up
those
a lot
are,
of good questions. So I'll go ahead and add in here that you're basically giving me a ton of ideas, Dr. McClelland, for things I should post about this week. So how about this upcoming week? You guys can expect for me to do a post about stretches postpartum, and then we can talk about nursing positioning. I don't have a tiny baby anymore, so I have to like pretend basically, but I can kind of go through that. And then or I could use a giant kid and it's going to look super weird. No, just kidding. Um, and then,
let's not do
or
that.
let's not do that. But then I also can talk about lifting body mechanics, safe
I think
versus
that's a great
unsafe.
idea. I
So I'll
think
put those out this throughout the week on Heal at Home Moms Instagram or Facebook.
I think that's great. Definitely the neck, definitely the hips as well. Um, but obviously everything in between. Um, One question here is I have a friend who is 35 weeks with baby number 4, and she has prolapse. Where should I help her start? Well, several thoughts. First of all, um, even though we are reducing some of the prenatal visits, women are still being seen. And so that can be assessed by their provider. This question is posterior prolapse. I would say the most important thing at this point is just to try to avoid constipation. Unfortunately, the weight of the baby and the uterus are such
Mm-hmm.
that you really can't do anything about these issues at that point. And so this
Baby's
is somebody,
literally pressing down and
correct,
can be creating
correct.
that. Yeah.
Yeah. And so there's a good chance that this might spontaneously improve.
Mm-hmm.
Um, and usually I would tell somebody, let's reassess at your 6-week visit. Um,
So,
that's
and it,
that's the main thing. Now, depending on what the symptoms are, I would address that differently. What are your thoughts?
Yeah, no, absolutely. I think those are great points. I've known multiple people in a similar situation where some completely resolve after the baby's born, some definitely better because there's different degrees of prolapse. So, for instance, I think the biggest time that people notice their own prolapse when pregnant is when there's actually like protrusion out of the vaginal canal when pregnant. And they're like,
Hmm.
what's happening? That's like the obvious one. And that's more likely to happen when pregnant because of the pressure of the baby. So, like Dr. McClelland said, avoiding constipation. So, if no one's ever taught you how to properly have a bowel movement, we go into that with Heal at Home Moms. We also, I mean, Squatty Potty is your friend. Make sure you're drinking plenty of fluids so that you are not constipated. There's a course. What's your stance, Dr. McClelland, on like Miralax or stool softeners? I mean, what's your stance on that while pregnant?
Well, I can tell you constipation during pregnancy is miserable.
Yeah.
And so I think looking, first of all, increasing your water intake, increasing fruits and vegetables. Most women will see the best benefit with something like Miralax. Stool softeners like Colace are fine, adding fiber, but at least in my experience, Miralax seems to be one of the easiest ways to maintain
Yeah.
regularity.
Because
If the
basic,
other things don't.
yeah. So basically, ladies, if you are pregnant or even postpartum, and so straining and constipation is really hard on your pelvic floor. And so if something's already kind of falling down, you don't want to be straining a lot and pushing that pressure. I would say it's like a ketchup bottle. You don't want to be like squeezing that and pushing down. All the pressure is going to go in that weak spot. So having good body mechanics, relaxing your pelvic floor, which if you don't know what that means, that's what we help people understand. Um, but yes, so the other thing I would say, just to be preventative and to be helpful, is once again, be aware of not doing heavy lifting and kind of bearing down through the pelvic floor. So if you're doing a certain activity and you notice that increased pressure or prolapse protrusion, then obviously while pregnant, the best thing you can do is try to stay away from that specific activity if you notice a worsening during it. Or the thing I always teach people, which is true for postpartum and pregnant, is for instance, if you're going to get up from a low couch, when you do that, often the pressure kind of pushes down. So one little thing you can do to help, take a deep breath in and exhale as you go to stand up. So blow as you get up to go, and that kind of helps distribute some of those pressures. So it kind of takes some of the stuff off a little bit when pregnant, right? Like the baby's way more than the the
Yeah.
pressures inside the core. But exhaling as you lift, exhaling as you go to stand up, all of those things can help a little bit. So
Well, when you post this week, I think addressing that, I think one of the things that I see happen the most, especially after having a baby, is instead of holding the pelvic floor up and the core in, when somebody stands up, they will actually Valsalva, which is pushing
absolutely,
down. So if
yes,
you could put something in there about that, I would love it.
it's one of my
Um,
soapboxes right there. So that's perfect.
what do I do to help an episiotomy? If everything's normal, everything's fine, I would just encourage you to leave it alone in the first 6 weeks. Minimize heavy lifting. You definitely want to minimize constipation. Those are all things that could impact healing. And then at 6 week visit, then um, most of the time it's going to be healed. And then the question is it more time? Is there something called granulation tissue, which is inhibiting the last part of the healing? Did the stitches tear? And so really at that point, it kind of it depends really on what the exam shows. So sometimes it's more time, sometimes it's other treatment. A different answer would come if everything is healed, but now you're having pain.
Yes.
That would be different. So basically, first 4 to 6 weeks, leave it alone. If you feel like you've popped your stitches, or if you're having bleeding, or you're seeing an increased pain, that is something that does need to be seen. So I do want to go back to the point that we are trying to limit um, routine visits, but there are still plenty of women that we're seeing in the hospital or in the office because they are having problems. We still want to see you.
Mm-hmm. Yeah, I mean that, like you said, certain things just absolutely have to be seen, um, and it's all a balance of taking care of the whole person. Um,
Yeah.
So, and if you guys want more specifics, we talked last week on scar tissue releases, both for C-section, but also for, like you said, episiotomy. So we talked through that a little bit last week. So if you want to go to the Heal at Home Moms YouTube channel, then you can find that discussion more in depth about scar tissue.
Um, we had another question about dealing with prolapse during pregnancy, but I think we answered that. My favorite question, well, I liked all the questions, but probably my favorite was, why do some women seem to snap back while others struggle to lose the mom tummy? Um, yes, I see that. I see that all the time. There's several answers. One of them is if it's baby number one, you are much more likely to snap back than if it's baby number four.
Mm-hmm.
Some of it is just genetics. You got good genes, or you got good belly genes, or do you not have the best belly genes? Um, then I found that the people that typically snap back the quickest are really the ones who have had who are lifetime exercisers, who are healthy, they are in shape, they maintained exercise during pregnancy, they did not gain they didn't overgain. So average weight gain is about 25 to 35 pounds. So people who gained over 40 pounds. So this is one of those situations where if you have been healthy most of the time, eating healthy, exercising, maintaining a normal weight, you are more likely to bounce back quicker. Um, and it's a challenge because there's so much going on in the first 4 to 6 weeks after having a baby. So
Mm-hmm.
it's not really your exercise at that moment. So it's not what you're doing at 4 weeks postpartum. It's what you did during pregnancy, what you did before pregnancy. Um, and then one thing we discussed last time was really starting, don't just jump straight into cardio, but
Mm-hmm.
really transitioning with strength exercises. Um, but if you've never really had a strong core, then you're going to have to work harder after having a baby than somebody who already
Yeah.
did it before.
And I think one of the important things to note with that is, like you said, and I'm a perfect example of that fact that I don't even always practice what I preach. So after my second, I signed up for a half marathon, like 6 months down the road. So I'd be like motivated to get out and lose the weight. And actually, for me, everyone's different. For me, running that amount of miles without strength in my core and my muscles actually made my stomach stay. So it worked against me because my body was trying to nurse and it was trying to hold on to calories. And so by me doing that level of exercise without the core base strength, um, it kept my stomach. And to be fair, I have diastasis as well. So if you are someone who is in good shape, you have lost the weight, and you feel like, I've had plenty of patients like this where they're like, I still have this stomach where I feel like I look 4 months pregnant. And first of all, you probably usually don't. It's just our own self perception. But I am one of those people who postpartum, I'd get small everywhere but my stomach pretty early on, and I'd have all these lovely people ask me if I'm pregnant while I'm holding a 4 or 5 month old, and I'm like, do you think I'm pregnant right now? 4 months? Like, seriously, let's think about this. Um, but the point being, it's really important to make sure you're doing the right kind of exercise. So, and that's true not just for women that have diastasis. So if you feel like your mom's stomach is not going away even while you've lost the weight, we have a video on our YouTube channel for how to test for diastasis, or of course, if you're able to see someone, go get that checked. But yes, so I feel like all women, whether you have abdominal separation or not, their stomach would benefit from the right kind of exercise. And what I mean by that is traditional like crunches and even planks early on, I would not say are the best choice. If you are doing a bunch of ab workout as you know it, that you did before pregnancy and you feel like your stomach is not getting flatter, it's probably because your muscles, like Dr. Mclelland's mentioned before, are not coordinating correctly. And so your deep muscle, the TA, the transverse abdominis, is supposed to help hold that stomach in, like a corset, a natural corset. So if that's not activating with your exercise postpartum, you'll feel like your stomach pushes out more than draws in. So we have a ton of exercises. I mean, our entire online program is made to help with that. And then we also have like free exercises as well. But you want to activate your deep core If you're not one of those who genetically just seems to go back to the way things
Yeah.
were. Though I think
I
even
think
women who look like they've bounced back, it doesn't mean their pelvic floor has. So there's
correct.
there's a lot of, just because you look a certain way on the outside doesn't mean your body's healing well on the inside. So we should all do these nice corrective, proactive exercises.
So, and while you're talking, there's a couple other things. One is posture,
Yes.
and you can look pregnant just by how you're standing. Um,
Mm-hmm.
and it goes back to also your stomach can pooch out if you are used to pushing out. And the Valsalva component that I just mentioned earlier, um, I think I'm glad you're going to address that this week, because that is something that I definitely see as well. People will push out when they're moving instead of support. Um,
Mm-hmm.
and then, then the posture idea as well. The other thing too that's a challenge is skin. Um, you could have great abs.
I know nothing about
No,
extra skin after babies. That is not something.
okay, well, some women, I will rephrase my comment.
You,
Some women,
I do actually. That's the reason I
I
say
know,
that. They gave me plenty
some
of it.
women will have a lot of loose skin that over time that does shrink back. But I have seen a number of women who have described, what do I do about my pooch? And it's skin. And that's what it is. It's loose skin. Um, that that takes time. But that's a harder question to answer.
Mm-hmm. I love what you mentioned about the posture, because I do tell moms all the
Hold on just
time.
a second. Stop. Somebody's messing with my dog who's barking.
That's okay. I also hear my kids like singing outside the door, so there's that.
I know.
I don't
My
know if you
dog's
could hear that or
barking
not.
because somebody's messing with them.
I mean, we're all
Uh,
home. I mean, it's gonna
I
happen.
know, we're all home.
But no, I tell moms all the time that it's great if you're doing like 20 minutes of corrective exercises every day. That's wonderful. But you're going to be frustrated at your lack of progress if that's all you're doing and your posture during the day is not correcting or being worked on. Because if we live in bad posture 90% of the day, 20 minutes of exercise, we're not going to see much progress with that if we live with bad body mechanics all day long. So, um, yes, I 100% agree. And I think that's most of the questions for this week. I know that with just a minute, something I'd mentioned to you is us just taking a moment to also recognize that the longer this goes on and the more that these moms are doing what they're supposed to and self-quarantining and social distancing pretty hardcore, um, it's really a struggle emotionally for everyone for different reasons. And I know for me personally, I struggled a lot when my oldest is now 7, but when she was a baby, and I went back to work, I really dealt with anxiety. That was like a new thing for me. And what's been interesting is while I've healed pretty well from that with work changing, so now I no longer have like my normal income. But also it means I never get to leave the house, which is also its own emotional thing. Like for me, work was kind of an outlet for me. And like our front yard is basically closed because it's like the greenway of a park. And so all these different things, it's been a struggle for me, and it almost feels like the best way to describe it is my emotional stuff this weekend has been, because it kind of took a turn for the worse, basically, which I think is to be expected. A lot of women are going through the same thing right now. But it reminds me a lot of my postpartum anxiety, just having difficulty focusing and feeling very scattered. And so just remember that you're definitely not alone. And you may have days where you feel like you got this, and you may have days where you feel completely overwhelmed. Um, and that for new moms, I think postpartum depression and anxiety look different for everyone. Would you agree with that, Dr. McClelland?
Yes, I
Um,
do.
so
I
I
think
think, go ahead.
Oh, you finish what you're saying.
No, I just wanted to really, I mean, from a distance, remember that a lot of counselors are doing telehealth. There's a lot
Yes.
of really amazing counselors out there doing telehealth right now. That's if you're feeling overwhelmed in this season, one, that's completely understandable. This is a very challenging season. Moms, we talked last week about how moms really need support, and most moms were taking that support or those outlets away. I know I had moms comment yesterday on my post about they have a newborn and another child, and their spouse is deployed or, literally on a different side of the world, and they're doing this completely alone. So I think that we can continue to brainstorm on ways to support each other. But I highly recommend people reach out to their doctors or counselors during this season, to keep that mental health good.
So, I think we can find good, we can find ways to empower. And a statement that I read or heard recently is adversity doesn't make you, it reveals you. And one of the things that I have seen as a positive is people being honest more readily about how they're feeling.
Mm-hmm.
So, one of the reasons why I like to do the telehealth with video is because I can see how somebody's doing, because a lot of people might say, "Oh, I'm fine. I'm fine." And then I look at them and they are not fine.
Mm-hmm.
Um, and so I think the first thing is this is hard. We have just been plopped into an alternative universe, and our normal rhythms are changed. They're different. And so we need to find a new rhythm, and we're all having to do that. And the first thing we say is, this is hard. Um, and then the second thing is, where's my strength? And one of the things that,
Mm-hmm.
one of the things I was thinking about is I utilize that every time I help somebody deliver a baby is, okay, this is hard. You are hurting. Where is your strength, and how do we access it? And how do we access it? Well, the way we access it is by talking to you, by seeing what you can do. Oh, that worked. Oh, that didn't work. And so being honest, communicating, sharing your ideas, um, kindness, encouragement to other people, um, but getting people talking and communicating, um, and realizing you're not alone,
Mm-hmm.
um, because we are not alone in this.
Yeah.
And
No,
I
I was
think
super encouraged by all the women that messaged and basically said I needed to hear that because I felt alone, and now to know that other people are having the same feelings, I think that in itself is validating. Yeah. So
definitely. Well, thank you. I think this went well,
yes,
and I think you now have a lot of ideas to write about this week.
I know I have my homework, which is great. I mean,
You do.
my whole point of doing this is try to help people. So you guys giving me what things that you need clarification on or guidance on is great because you basically just help me know what to talk about and help you guys. So
So
um,
everybody has homework out there, and that is continue with the great questions.
yes, yes, keep sending questions. I believe, did we say next Monday is going to be at noon? Is that right?
Correct, correct.
Okay, so we'll change the time from here on out to noon. And yeah, and if you
Because
guys
I
want
have
something
to
up,
I have to work too.
and if you guys need some uplifting thing, I think really a really fun thing right now on YouTube is Some Good News, SGN. If you haven't seen it, YouTube it. But super fun, uplifting stuff where they talk about some of the sweet things that are happening right now since we're all hearing so much hard stuff. It's a really sweet resource for some good news. Blessings to
Can I
everyone. And
one
what?
other request, if you know
Yeah.
any healthcare workers at all, whatever they do, um, please reach out and say thank you, because they really, really have earned and deserved it.
Yes. I 100% agree. All right.
Okay.
You guys, we'll
Take
see you
care.
in a week.
Okay. Bye.